All right. Welcome, everybody, to the Maine Rural Healthcare Education Grand Rounds. Thrilled to welcome everybody here. My name is Dave McClellan. I'm the program manager for the Merge Collaborative. These Grand Rounds are hosted by the Merge Collaborative and the Building Maine Network, both programs that have been sponsored by the Department of Health and Human Services here in Maine. And we'll be excited to announce new funders in the future as we continue this program. Today, I am very excited to introduce Dr. Corey Smith. Corey is a psychologist, and he is the Director of Behavioral Health Education at the Maine Dartmouth Family Medicine Residency. And he's worked in primary care medicine and family medicine education since 2010. In that time, Dr. Smith spent years with a focus on resident wellness, community building, and engagement in resident issues and needs. Recently, Corey has focused upon earning a certificate as a mental performance coach and is currently a performance coach candidate with the Association of Applied Sports Psychology. Really interesting. The connection between mental skills, performance enhancement, and medical education is a natural one, and Dr. Smith is passionate about learning about the impact of mindset, habits, and mental skills in reaching one's greatest potential. So with that, I'm going to hand the floor to Dr. Smith. To anyone that's recently arrived, we encourage you to leave your cameras off unless Dr. Smith invites you to turn them on, and we'll definitely all turn those cameras on when it's time for the Q&A session towards the end. Dr. Smith, the floor is yours.
All right, thank you, David, and thanks to Annie and my boss, Kate Hoffman, for suggesting that this would be a good topic for us to talk about today and inviting me to come and present today. What we're going to talk about today is about a little bit different way of interacting with our learners, specific to coaching. And we're going to make some distinctions during today's presentation about what coaching is in comparison to like advising and mentoring, and it's quite a bit different. And we'll talk a little bit about that and how we kind of develop these relationships, facilitate the type of work that we do in coaching in comparison, and learn a little bit about the research in this area, as well as where to go for further training. What I want you to kind of think about, though, is the concept of coaching kind of globally, right? When you think about coaches that you might have had if you played sports as a kid, if you were a musician, if you were an artist, think of those people in your life that you considered coaches, right? And just kind of have that in the back of your mind as we go through this stuff. When we look at what coaches do at different levels in terms of sports, or if it's in artistic performance or in other areas, business, things like this, we're going to make some distinctions about ultimately what our goals are. Because in the long run, a good coach is somebody who pulls things out of you rather than installs things. And so, and we'll get all to that here in a minute, but let's get some of the business out of the way. Let's see. First things first, I don't have anything to declare. I am unfortunately in my last 2 months here at Maine Dartmouth, and after my departure, my plan is to open a private practice. So I don't have anything to declare now. 3 months from now, I probably would, but that's not the case today. So next up here, just for folks to make sure that they get their CEU credits for today. Everybody can read, but if you text the code 96271 to this number 207-808-7704, they'll get you set up if you have any problems. It shows you on this slide that you can just text that email, your email, to the same number. If it doesn't work, I don't know, you're fresh out of luck. I'm sure David can help you get set up and let you know what to do from that point. I also understand that, and this is just another disclosure slide, but I also understand that here's all the groups that are helping us with accreditation. But this is the slide here of the app for you to download to your phone to make sure that you can get connected here. And again, David will be able to get people set up if there's any issues that folks have with the process going forward. Okay. So first off, today what we're going to talk about is, again, that definition and kind of contrasting coaching with advising and mentoring. The goals of the relationship, the way that the relationship works, the way conversations work are going to be very different in those settings. And so we'll kind of talk about making those distinctions. We'll talk a little bit about the research on the impact of coaching and both the stuff that's in support and the stuff that's maybe not so much in support. One of the things that you're going to leave this presentation with is an understanding that there's tons more work to do in this area. And if folks get excited about that and get some interest in that, I would love to work together with anybody who wants to do that kind of research going forward and talk about how that might apply at your setting. And then finally, just describing the process of coaching. What do I have to do to be a coach? How does it work? How do we start the process? How do we go through this with a learner? And talk a little bit about some of the skills that we might focus on outside of kind of a formal training in the area of coaching the medical learner. And so we'll talk about some skills to practice, and then, of course, at the end, some resources and where folks can pursue this type of training and certification if that's something that they find interesting. Okay, so the first piece is what is a coach versus a mentor and advisor? Well, when we think about a coach, we oftentimes think about, obviously, sports. Oftentimes we think about performance artists and certainly business. Folks have definitely heard of the occupation of a life coach, right? Essentially, a coach is someone who encourages the student, the learner, to learn new skills, to develop personal insight, right? Promote self-reflection, and then provide feedback to the self-development of the learner. Okay, so when I think about this, I oftentimes think of a coach of younger kids, right? So if we think of a basketball coach, what they're going to do is they're going to give the kids a basketball and they're going to say, here's how you dribble. They're going to show it to them, and they're going to say, so try to do that a little bit. And the kids are going to do what they do, and they're going to slap at the ball, and they're going to give them feedback. But ultimately, what the coach is trying to do is to get them to use their body enough times in interaction with this basketball to learn for themselves, oh, this is how my hand dribbles. Not that there's a right way and a wrong way, especially at that stage in motor development. Simply, this is how my hand dribbles a basketball. This is how my hand shoots a basketball. Things like this. Rather than, okay, hold it like this, hold it like that, and then go up this speed, and then you want to bend your elbow like this and use your shoulder like that. It's too much. What we want to do is pull that skill out of the learner, and then we're going to kind of work with technique and things like that as we go down the road. In contrast to mentoring and advising, they're going to use a little bit more traditional, more directive approach in their interactions with a learner, right? So an advisor, we can make an argument that an advisor's job is, I got to get you through medical school. I got to get you through residency. So these are the things that you need to do. You need to take this test. You need to study this long for it. You need to take these rotations. You need to do this research if you're going to be competitive in such and such residency match. And it's going to be more directive. In other words, I'm going to use my experience and my expertise to help you learn what you need to do to reach your goals, right? And there's tons of value in that. And we need advisors, right? We need mentors. Coaches are different in that a really good coach in this context isn't necessarily telling the learner, here's what I want you to do. They're pulling out of the learner, what are your goals? How do you want to get there? What do you think the things are that you need to do to get there? And are you doing them right now, or are there things that you need to change? So a lot of the role of the coaching relationship is going to be into this, again, kind of pulling out of the learner the skills that they already possess. And for any of the psychologists or those of our medical colleagues who have any training in motivational interviewing, this is going to ring a lot of bells for you. And we'll talk about some of the skills that are going to kind of jump that gap for motivational interviewing that are going to ring true very much in the coaching relationship. So what do we use coaching for in the medical setting? Well, there's tons of things that we might do. The first might be the struggling student or resident who just needs a hand. They're not performing at the level that we need them to, and they're going to need some help. Specific to coaching, if we're doing this, if we're going to be true to the concept, this would be without the aspect of any evaluation. So the coach in this context would have access to all of the evaluations, all of the information, the portfolio, everything for the learner, but they're not offering any evaluation. They're not saying they're not responsible for the evaluation at all. Their job is simply to help the learner figure out what they need to do differently to come up in whatever skills that are identified as a weakness, and they're helping the learner identify what are your goals, what do you want to do. So that evaluation piece is what we take out, and that's in contrast perhaps to the advisor or an attending in this situation. So this also might be part of the onboarding process when folks get into medical school. University of Colorado Medical School has this as a part of their curriculum for their students. And this is just part of the deal. If you go to medical school at the University of Colorado, you're going to have a coach through a portion of your time in that medical school. Additionally, this might be something that is set up longitudinally for residents. This might be part of the onboarding process for new faculty. It not necessarily triggered because of any issue or anything like that. This is just about how we support our learners and support our new faculty members. Especially in medical school and as well in residency, a person might be meeting with a coach because they want to get a little bit better in a specific area. Right. And so this would be a little bit more focused than what we spoke about previously as just kind of a set part of the curriculum. This is designed to be a little bit more focused on, it might be a learner who has problems taking standardized tests. This might be a learner who's having a little bit of trouble in kind of developing their skills in this area or that. It might be note writing. It could be anything. And so they would use a coach to help kind of guide their pathway and help them figure out what they need to do to kind of come up in that area of skill. Portfolio creation and management for our medical students, making sure that that they have a good handle on what they're going to do and that they're kind of shaping their portfolio to make sure that they're going to reach the goals that they have for application for residency. Self-care is always, you've brought in the psychologist, so we're always going to talk about self-care. Part of the research that we're going to look at here in a minute is specific to this area. Obviously, most people understand that when a person goes into medicine, they've chosen a field that's really, really hard, and most people can't do it. Those that graduate from medical school and finish residency are in a very small, select group of people that were able to navigate that. Some folks do it better than others in terms of their self-care, but it seems like kind of a no-brainer that if we can really reinforce good self-care and wellness in our medical students and residents, then we're going to produce better doctors every time. Healthy doctors are going to be better doctors, and that starts right there at the beginning of training. And so the advocacy here is my bias is that if we start these processes as early as possible, then we're developing this resilience as students and residents move on in their training. Also, the challenging learners, those that may or may not have an area that they need remediation on, but also really high functioning learners that need to figure out how they're going to continue to challenge themselves, how they're going to continue to grow and learn a big part of this process is the development and nurturing of the growth mindset. The number of you know, highly successful people that are keeping going, they're keeping learning, they're getting new certifications, they're learning every single day. That's a great predictor of future success. It's also a great predictor of future job fulfillment if we're constantly learning and we're constantly kind of sharpening that saw. So what's the evidence look like? Well, the Stanford Medicine Medical School Office on Coaching, they've got a certification program that you can take, and there's information that I will send out. I tried to send a file through in the chat, but it didn't go through before. But it has these websites in there, so don't worry about this stuff. It's going to all be included in the handout that I send out. But we do find that when coaching is focused in on this area of wellness, of self-care, we do see a decrease in emotional exhaustion and burnout, improved quality of life and resilience, and that's across different specialties. Also, we found, and this is specific to professional fulfillment, is specific to those physicians who choose to become certified and work in the area of coaching. So the study looked at faculty members in medical schools and residencies who became certified in this area and measured their professional fulfillment against those of their colleagues, and found that this is an energizing thing for experienced faculty to be able to work on, which goes along very well with this connection that we make to motivational interviewing, and that we find that physicians, residents and attendings who are well trained and utilize motivational interviewing effectively report less burnout and more professional fulfillment in their work as well. Specific to support for diversity and inclusion, one of the things that I really like about this aspect of coaching is that at a baseline level, what it's communicating to learners is that we value you, we want to support you, and we want to take all of your strengths, all of your areas of opportunity, and we want to build all those up, right? So when you think about residents and medical students from diverse backgrounds, an example being Maine Dartmouth, where we don't have a ton of diversity on our faculty, but we have a ton of culturally competent faculty members who understand that this is a really important aspect of our work. One of the best things about Maine Dartmouth is that we understand that diversity is a strength. And so when we're supporting our learners in this way, especially in coaching where the focus is so much on the relationship, then we're contributing to the promotion and the retention efforts and making sure that we're kind of walking the talk in terms of diversity and inclusion, even in the sense of, on the faculty here, we all look very similar. But again, it's that cultural competence and that willingness to work together that really communicates our commitment to diversity. Peer coaching programs are have been studied a little bit, and again, this is an area where we need much more research. But what we find in peer coaching is that this is helpful in development of teaching strategies, more effectiveness, and increased self-awareness into teaching effectiveness. One of the biases that we have in medical education is that if you've graduated, then you must also be a teacher, right? And we know that's not the case. There's tons of people who have terminal degrees that that's just not where their skills lie. But in the context of good peer coaching, we can develop a lot of good strategies, more effectiveness, and again, that self-reflection that's required to improve almost in any skill. But if you don't have that skill and it's not been nurtured, it becomes really hard to develop as an individual. There's a short-term impact on psychological health. And in this particular study, they looked at depression and anxiety and saw some improvement there, but there's another side to that, which we'll see in a second. The promotion of professional identity, I really like this aspect. And one of the things that I think about is this, the aspect of coaching that really relies on the building of that trusting collegial relationship. One of the things that we see is that those relationships can kind of insulate learners from that hidden curriculum and that hierarchy that we see in the educational system. What it's promoting is a focus on self-regulated learning, right? And then fostering habits for lifelong learning, right? And that growth mindset that we talked about before. I'm a big believer in habits. As an individual, as a psychologist, if you're ever in a therapy room with me, you're going to hear me talk about what are your daily habits. And if we can help our learners develop good habits in terms of the way that they approach their development and their education, then what you end up with is a 70-year-old physician, like some of the one particular of the founders, Alex McFedrin, here before his passing. He was walking up the stairs and reading his copy of neurology while he was precepting. Alex was a lifelong learner, and that's how you get longevity. That's how you stay relevant. That's how you stay effective, is every single day with those habits. And Alex was a wonderful example of that. And there's some drawbacks too. One of the things that we see is some variability in outcomes and effectiveness, depending a lot on the coach's training and what model that they're employing. Peer coaching without formal training shows just less favorable outcomes when compared to training. When compared to coaching by somebody who's well trained and certified. I'm going to use training relatively loosely. I think that the programs that we're going to see here at the end will train you very well in this field. And we're also going to talk about skills that folks can practice that are going to put you right up there in that same kind of area of skill. We're going to go back to the study about short-term impacts on anxiety and depression. The problem that they found here was that there wasn't a long-term solution for those symptoms for the folks in this study. One of the possible explanations here is that this was a time-limited group intervention. And just like a medicine, if you stop taking it, magically it stops working. If you stop doing the self-care activities that are helping you with your anxiety and depression, it may be that you've just gotten past that point in your life and the things have gone away. But if we know that medical training is a source of anxiety and depression for our learners, then what that needs is habits. They need to develop good habits on a daily basis that include self-care and self-directed learning to get through this really rough period of time in their life. Another drawback, again, we just don't have a lot of research on this and how it can be effective in the ways that it's the most effective and why it's the most effective. But over the long run, and maybe some people in this presentation today are interested in doing more about that. Where we find some limitations also is in the technique that the coaches use. And again, this goes back to training. It's less effective in terms of stimulating reflection when that coach is focusing on their experiences rather than the learner's development. Again, when we compare coaching to mentoring and advising, the mentors and the advisors, we're kind of injecting you with our wisdom and our guidance, whereas the coach is pulling it out of the learner. So it's a different strategy, it's a different philosophy. We also don't know much about the impact of coaching on patient outcomes, right? So we know that we've got some moderate evidence of the impact of coaching on doctor well-being, enhancing skills, all of these things. Again, the evidence is limited, but it's there. What we don't know is exactly how the coaching relationship impacts patient outcomes. Skinner did their work with surgeons and didn't see an impact in their, this was a meta-analysis, and they didn't see an observable impact on patient outcomes from that. However, again, if you have a healthy surgeon who is feeling good about their job, feeling good and healthy about themselves, my bias is that they're gonna do better clinically, but we just don't have the research to back that up yet. Okay, so how do I do this? One of the things I think that's really interesting about this concept is that you don't actually have to be a subject expert to be a coach. When we think about life coaches or personal development coaches, these are not people who are working for Fortune 500 companies. These are not CEOs. These are not necessarily folks that are engineers or carpenters or physicians or anything. These are people who have a good understanding of how do I make a relationship with this person, and then how do I help them to look at the resources that they have and the opportunities that they have for growth, and to utilize those things in a way that they are developing themselves. The coach doesn't, in these contexts, the coach doesn't actually develop you. I don't need to teach you to be a better physician. I need you to use your own resources to become a better physician on your own, right? I think street cred is helpful, right? It's nice to know that your kid's basketball coach understands basketball and has played. But if he can get the kids together, if he can get the kids having fun, if she can teach the kids that, hey, it's more about effort, it's about working hard, it's about playing together and as a team, boy, I'll take that rather than a kid who leaves, fifth grade basketball practice being able to shoot a good 3-pointer. So the first competency, and this is from a study that you all will find in the Lit Review well, is just understanding what's the process and structure, setting clear goals that are learner driven, helping them develop their action plan, and then managing the relationship. That involves building trust, rapport, empathy with the learner. Again, this is going to sound a lot like motivational interviewing to folks who are cued into that area. Some of the skills that we need to develop in the coach are really effective communication skills, active listening, being able to ask probing questions that facilitate reflection, right? Because again, we're always going back to what is the learner's perspective on this. An understanding of some of the theories and models that go into that we use in the context of coaching, and we'll talk about that, one of those models in a second. And then finally, the coach's commitment to being a continuous learner, to having that growth mindset and developing their skills, seeking feedback, et cetera. One of the things that we know is that if I'm coaching you and I'm telling you to do all these things that I'm not doing, I'm going to lose credibility right there. So if I'm taking an active role in staying up in the research, making sure my skills are on point, and developing myself every day, I get much more credibility in helping another person realize that that's a strategy that they can utilize. Appreciative inquiry is, again, this is to me all MI. But appreciative inquiry is a strength-based approach. It's collaborative, just like MI, and it focuses on identifying and building upon what works rather than what the problems are. In sports psychology, when we're not dealing necessarily with a mental illness, what we do is we kind of make a transition from a fixing it model to a building it model. Oftentimes, even in my clinical work, I'll say to people, there's nothing wrong with you. We don't have to fix you. We need to build up some skills so that you can manage your mood better, so you can manage your anxiety better. What we want to do is take what you have and make it better. And you're going to be the one that does that, because you're going to be the one that does these things on a daily basis and develops these good habits. In appreciative inquiry, we look at the 5 Ds. And the first one is definition. What do you want to focus on? Again, this is all learner driven. So the learner decides, I need to get better at writing my notes and getting them done on time. I need to get better at giving bad news. I need to get better at family meetings. Discovering what's going well, what's gone well in the last few days, what's gone well when you've made these changes, what's working. We can focus on what's working and build on that, rather than this focus on, well, you're not doing this good and this good enough and that good enough. The dream is the magic wand question. What's the ideal way for this to go? What's the ideal way for you to reach this goal that you have in this area, or for your career, or for this patient encounter, et cetera? And what's the best way for that to go? And then what do you need, the design pieces, what do you need to do to make this happen? What changes do you need to make? What would you see yourself doing if this went perfectly that you're not doing now? And then you're going to make your decision to decide, well, let me start doing these things and see how it goes, right? And then deliver. This is, again, another MI question. What do you think you'll do? It's a matter of, we know what you want to have happen. We know what's going well. We know what's ideal. We know what you would need to do to make that happen. What are you going to decide? So what are the skills that we need to practice to get good at this if we're a little bit too busy or our CME money isn't good enough to go to the full meal deal training that we'll talk about in a second? Well, again, my bias is in motivational interviewing. And the first thing that I think about that pertains to the relationship, to the rapport, to the trust building that we think about in coaching is the basic skill in MI, which is ORS: open-ended questions, affirmations, reflections, and summarizations. We all know what open-ended questions are. Those are questions that I can't answer with a one-word yes or no, up or down, 10, 15, whatever it is. Affirmations are when we get to put on our cheerleading hat and affirm what people are doing well, where their strengths are. Reflections is where it gets a little bit complicated, and I can't recommend enough getting some training in motivational interviewing if reflections is something that you struggle with, because we can get a little bit caught up in, oh, should I do a simple reflection, like just repeating back to the person, or do I try to take a stab on reflecting the emotion in the moment? With good training, that becomes a much easier decision to make. But essentially, the reflection is that verbal expression of empathy that communicates to the learner, I heard what you said, I understand what you mean, and I'm going to take a stab at what the emotional content is underneath. And finally, the summarization, which is just a bouquet of reflections. And again, these four skills allow us to build rapport, build trust, and always kind of putting back on the learner that self-reflection that we're looking for in the coaching environment. The writing reflex is what we do when we know something bad's going to happen, right? This is when I start begging my patient, you have got to quit smoking. You're going to die. This is going to kill you. You got to quit. You got to stop. You got to leave this person. They're going to end up killing you. This stuff is going too badly. This is too dangerous for you. What we end up doing inadvertently is triggering the reactance of the grown adult that we're speaking to and saying, hey, I'm going to make my own decisions. And just because you said it to me, now I'm going to do the opposite. That's my first instinct. Specific to other skills, we start looking at cognitive behavioral therapy, and some of the skills that we think about that are pertinent to coaching here are our ability to just reflect back for the learner on the emotional content of what they're talking about, right? So the medical student who says, "Gosh, I'm really, really wanting to, be able to match with an orthopedic surgery residency, and I just don't know where I'm at." The reflection of that concern and that fear that the medical student has that they're not going to be able to do that is an important piece of that reflection, providing empathy and building trust and rapport in the relationship. Being able to point out positive and negative self-talk with curiosity points to the student's perception of their strengths and weaknesses in the setting, right? I'm just no good at that. Well, it may or may not be a true statement, but it's not a helpful one. I'm not good at that yet is a way to reframe that unhelpful thought and put the control and the responsibility back in the learner's hands. Another thing that I think about is we're in a season right now where athletes are committing to colleges and they're deciding where they're going to spend the next 4 years in terms of their athletic career. And a friend of mine's son just committed to play basketball at a school in New York City. And he said to his son, now you got to remember, this is a starting line. This isn't a finish line. It feels great to be committed and it feels like a weight is lifted, but now's really when the work starts. And for us to understand for our learners that, passing step one, passing step two, matching for residency, all of these things are starting lines. They feel good and it's a relief to get it over with, and that's important, and it's important to honor that feeling, but also to remember with that growth mindset, now it's what's next, right? And if we maintain that attitude with a sense of curiosity and optimism, well, then what's next? The sky's the limit. But if we feel like, oh, thank goodness, I'm finally done. I got into residency. That's wonderful. That student's got a big wake-up call coming when they start to be on their first shift of nights on inpatient medicine, because that's going to start to feel like a starting line all over again if they're not ready for it. So these are some places where I took some of my information and places where you can get some good training. In the top right corner there, the AMA That is the American Medical Association's YouTube channel. They've got a series of different videos on coaching basics, just the skills that that we're looking for in the area of coaching the medical learners. It's a nice resource. If you remember from your own training when you watched videos and the video ended with, "Gee, Doc, I never thought of it that way. I guess I'll do exactly what you want me to do, and my health will be better because of it." That kind of cheesy interaction that you remember. This is very much of that. But it also does a nice job of kind of showing some examples of where people don't really hit the mark with the skills that we're looking for in coaching. So I encourage you to check it out. If you want to learn more about CBT, you can go to the Beck Institute there. And the Center for Appreciative Inquiry has lots of good information in that modality. And again, we're going to look a little bit here now on different training opportunities. So the American College of Physicians, Physician Coaching Institute, Harvard and Stanford both have training programs that can get you certified and trained up in coaching for the medical learner. I'm going to throw a plug in here for the UMass Center for Integrated Primary Care, partially because I took the course in motivational interviewing there, and it literally was the moment where I understood MI in a way that I can use it effectively and teach other people to use it now. One of the other faculty here at Maine Dartmouth, Alyssa Finn, also took the course. She raves about it as well. It's definitely well worth your CME money for this course if motivational interviewing is a skill that you want to get better at, and if coaching is something that you want to look more into. The parallels between coaching and motivational interviewing, there's a ton of them. Here's all my groovy references. And I appreciate everybody's time, taking the time out of their day to come and listen to me babble on for almost 33 minutes on this subject. But if you're excited at all about this idea and research oriented in any way, I'd love to work together with you on creating something that we could take a look at and measure. So with that, if there's any questions, I'm happy to chat a little bit more.
Thank you, Dr. Smith. I invite everybody, turn your cameras on. I know we always get a good group discussion going after these presentations.
Dave, you're setting me up to fail, man.
No, you did great. You've already done wonderfully. You already knocked it out of the park.
Discussion, but if we don't today, then we know whose fault that is. I have a file that I'm going to try to upload here and see if this puppy goes through. And it didn't. So David, I'll send it to you, and you can send it out to everyone. But I'll bring it up, and if it's okay, I'll just share my screen quickly.
Sure. While you do that, I'm going to share that in my work history, I've had one organization that understood what you said about the difference between coaching and advising and mentorship, and they actually assigned a coach. And they defined that role of what the coach does for you, and it was game changing, right? It was a really powerful tool from a organizational management perspective to keep the team focused on what they wanted. And I'd be curious of this group, if your organizations, I already can tell you have a wide range of folks here, have defined this coaching role already. Is that something you've already done? If the answer is no, it's no surprise. Yeah. It's not something I've seen in a common way. I just didn't know if someone's already thinking of it that way.
Yeah, I agree. I feel like there are many ways as academic faculty that we find our way into these positions, maybe because we have some natural level of ability, but it's hard to teach people, or in our medical training, we're learning more about patient care, obviously, than we're learning about how to be a teacher. And many of those skills are in parallel. We teach our patients all the time. We teach the people who we're training besides. But I often think about this for our new faculty. Mentorship happens over time, and some have more natural instincts in these things than others. But really trying to be intentional about how we support and guide somebody, especially in a new faculty role, is something that we need to continue to work on here at Maine Dartmouth for sure.
It's not surprising to me either that there weren't a ton of hands jumping up when David asked that question, because it really can feel like something a little bit soft in terms of medical education, and but what we're trying to develop is the person, right? We're trying to develop the physician. We're trying to develop the teacher in this sense, rather than, I mean, and it's great for clinical skills. It's great for skill development, all of those things. We've got research to back that up. But what we want ultimately in any coaching relationship is for that learner to leave our relationship, leave our setting, feeling that they are not only a better player, a better physician, a better artist, a better dancer, but a better person because of the skills and the things that they learned in that relationship, independent of being able to do a good circumcision, right? Just quickly, the resource, and David, I'll send this to you to send out to everybody. This just has here at the top just resources that you can look at specific to coaching, the YouTube videos that I mentioned, as well as the faculty handbook that the AMA puts out in this area, and a couple of some informal sources. The Better Together group is the group that they started at University of Colorado to try to make this a part of their curriculum. And then here at the bottom are the different training sources of training that folks can get to. So David, I'll send this to you afterwards, and then you can send it out to everybody who's on the call.
That's great. And folks, put your email if you want to receive that, maybe just put it in the chat. The Maine Health folks I can see automatically, and of course a lot of you I know through the Merge Collaborative. But if you're outside of network, I might not have your email address, so just drop it in the chat and I'll send it out to you. It's great.
And Annie, is that your hand up?
Yes, it is. Thank you.
I love your office. That's fabulous. I don't know
What
where
of you.
Isn't it?
Who knew Lewiston had?
My goodness, oceanfront property in Lewiston.
So my question is kind of related to what you were just talking about, but how would you suggest, or how have you been doing? Because everybody's really busy, and it's been great that you have acquired some of this additional training and that you've been sharing with us today, but you can't send an entire faculty to get supervised or certified as a coach. But how have you been supporting the rest of your faculty in developing some of these skills, and like what would you prioritize as high return on investment skills for faculty who really just want to optimize their impact with their advisees? And where would you start if you want to kind of just up the level of the faculty group in supporting residents?
Yeah, so Annie, it sounds like you're kind of talking about, like, in lieu of trying to get Kate to pay for all 97 of our faculty to go to Stanford for this training, and do that, which is obviously kind of silly. What you're asking about is, like, how do we kind of take the advisory roles that we're in and start to kind of develop some skills to start having the spirit of coaching, and kind of changing the hats kind of mid session is what it sounds like. I think that for me, I think that the first start is just to make that distinction between again, advising and coaching, and the acknowledgement, like we say to our residents when we talk about MI, and especially with family medicine residents, right? You're putting on your cardiologist hat, your orthopedics hat, your nephrologist hat. Well, we're going to give you another hat, and that's going to be your MI hat. So part of the idea with faculty is just communicating that if this is kind of what you're going to want to do and kind of veer into this, then you are going to take off that advising hat and put on the promotion of self-reflection hat, the coaching hat. And in terms of the skills, I go back to motivational interviewing, because the whole concept of MI is that the patient already has the resources they need inside of them already. What we're trying to do is to help them to figure out where they are and how they can use them in a way that's going to best suit the goals that they've established. So for faculty development in this area, short of doing the full meal deal training, those are the things that I want to focus on the most, right? So heavy on, kind of maybe some role playing, which I know everybody loves in medical training. Is the most favorite thing for physician attendings and residents to do. But if we can trick them into doing it and executing some of these skills in terms of open-ended questioning, reflections, affirmations, kind of resisting that writing reflex. I can't imagine the number of times in an advising setting, especially in medical school, where the medical student, who maybe passed their, exams not with the best scores, but they say, well, the only thing I want to do is go into dermatology. And you're going, that's not going to happen. Like, you haven't done research. Your test scores aren't that great. Like, to resist that writing reflex and start to go, okay, well, let's go back then and look at, if this is your goal, how does it work? How do we go on about doing that? What are the things that you're not doing now that you would have to do to make that work? So for me, my bias is the MI stuff hits that right in the bullseye, because it's always putting it back on the learner or the patient about, what do you think you need to do? What's next? What's the pros and cons of doing it this way versus that way? So in terms of those skills, independent of going to the full meal deal training, I think it's the MI stuff.
Outstanding. Anybody have any last questions before we call it? All right. Well, thank you. Thank you, Corey.
Thank you for having me. I appreciate everybody taking their time today and being here, and wish you a good rest of your day.
And I'll tell you,
thank you so much,
month,
Corey.
We have the next one is actually very similar to this. It's Dr. Monica Tim from Maine Health is going to be presenting, and it's going to be on effective writing of evaluations. So it is the writing reflex, right? But the formal evaluation process and letters of recommendation, impactful, meaningful letters of recommendation. So all important things for educators as well. A nice little follow-up to the coaching side of things. So we do hope you'll join us next month. So that's June, I want to say 13th. That's that second Friday in June. And until then, we hope you guys have a great spring. Enjoy the good weather.
Thanks so much, David.
Thanks,
I'll
everybody.
send this out to you in just a minute.
Perfect. Thanks, Corey.
Have a good day.
You too.